Well, thank you. I'm going to do my best to be within 7 minutes. These are my disclosures. So this is the outline. We're going to try to answer some of these questions at the end of this talk. Can we predict if an aneurysm is going to rupture? What does contrast enhancement of the aneurysm wall mean? Can we measure contrast enhancement? And what's next? So all of these are valid questions that we're going to try to answer after this talk. So, how we can tell a patient if an aneurysm is unstable? Somebody comes to your office, 5mm MCA aneurysm. How can we tell if that aneurysm is most likely going to rupture? So we don't know. And it's a puzzle because we have different components for the question. We're going to address each of these components. We're going to start talking about signal intensity and contrast enhancement. Back in 2013, Charles Mattook in Yale, he started scanning patients with multiple intracranial aneurysms, and he realized that some of these aneurysms enhanced more than the other ones. Some of these aneurysms were taken for clipping, and the aneurysms that enhanced more were the ones that rupture. There have been several studies after that. One of our study was published last year, and we tried to correlate this imaging finding with histopathology. So basically, for example, we have a carotid terminus aneurysm on the left, did not enhance. You see it on the axial MRI. The dome of the aneurysm was clipped, and we sent the tissue for pathology, and we stain it, and we quantify the amount of elastase. We have another case of a different aneurysm that it did enhance. You see it on the CTA and on the axial CT MRA. There's contrast enhancement of the left MCA aneurysm. Again, the aneurysm was clipped. The tissue was sent for pathology. And interestingly, we found that there was increased concentration of macrophages on the aneurysms that enhance. Also, we found that the aneurysms that enhance seem to be have a thicker wall, which is counterintuitive because you might think that the aneurysms that enhance are more likely to rupture, might have a thinner wall. So these are complex questions. And us and other groups have found similar things. This is like a summary of all the studies that have been published about this subject. In total, we have around 1,400 patients that have been studied with high-resolution vessel wall imaging. And I just want to underline in red, in the red boxes, what was the, how did they measure vessel wall enhancement, And it's very surprising that most of the studies use a subjective analytic method to measure. So basically, two guys sitting in the same room saying, yeah, this aneurysm enhances and this aneurysm does not enhance. So it's a big methodological problem, and that's one of the things that we wanted to tackle at the University of Iowa. And we have access to a 7T MRI. As you know, 7T has a really good spatial resolution, allows us to see in detail the structures of the vessel wall and the aneurysms. We have an axial, coronal, and sidal view of an ACOM aneurysm. In the upper row, you have the pre-T1, and the lower row, you have a T1 post. And, initially you don't see much, it's not really anything surprising about this ACOM aneurysm. But when you do a detailed analysis of an aneurysm with a high-resolution imaging of the 7T, you see that you have different areas of enhancement of the aneurysm wall. You see like this cap of enhancing tissue around the aneurysm. You can see the wall of the parent vessel. And we are able to measure signal intensity, which is basically measuring how much contrast enhancement the aneurysm has. And you see that this dot in the frontal wall of the aneurysm has a signal intensity of 349. And we correlated this with what's the gold standard, which is a 3D rotational angiogram. And surprisingly, what something seems to don't show anything has actually a bleft, which is known to have a lower, high risk of rupture. So, we're very optimistic that we can finally see signal intensity and contrast enhancement. This is a process that we have developed with the 7T scanner. We're looking to do it on the 3T. Involves a lot of acquisition processing with code registration, segmentation, and then sampling of the ROI. And we're trying to automate the whole process. This paper is going to be published soon. We took all the described methods to measure signal intensity and contrast enhancement to give you a real number of what's going on with the aneurysm after you give contrast. And we found that the best method, in this case, the gold standard was an aneurysm was 7 or more millimeters, that by ECUIA data are the aneurysms that are more fragile and unstable. And we found that the best ROC was the pituitary stalk ratio. We struggle a lot with the methodology, trying different techniques, how to measure it, but it definitely seems that the pituitary stalk is the best way to normalize and get a ratio that's going to help us to give a quantified number of the contrast enhancement of the aneurysm wall. And then you might think, oh, you guys did it with a 7-millimeter aneurysm. What about the smaller aneurysm? This is a very interesting case that we saw. The patient came with a stroke, a pica aneurysm, had a CTA. We found this little bump at the origin of the pica. 1 year later, the patient came back, underwent another imaging study, and you have this bile-off pica aneurysm. And we put this patient through so definitely an unstable aneurysm that's changing in morphology in front of us. We did a high-resolution 7T MRI, and we found that this diffuse enhancement of the whole vessel wall of the aneurysm. So definitely something there, something happening. We think it's an inflammatory process. But that's not just part of the picture, What's the gold standard now? It's 3D rotational angiogram, It's a diagnostic angiography. But we have to realize that these aneurysms are microenvironments. There are a lot of flow conditions within the aneurysm sac that we don't take into account. The wall has its own biology. There's different parts of the wall where you have different flow jets, decreased wall shear stress. So it's a lot adding to the story besides just the traditional 3D rotational angiogram, and that's what we're looking at. So that's part of the puzzle. What about the next part of the puzzle? What about iron? There's a lot of studies looking at iron. We know that this is a moving target. It's same as patients with intracranial atherosclerosis, that sometimes you do imaging of the plaque and you see microhemorrhages within the plaque. So the same thing happens with iron. This is femoxytol. This is a study led by one of my colleagues, David Hassan. He's definitely one of the pioneers in this field. And usually, basically, femoxytol, what it means is iron particles. So he injected femoxytol. He did high-resolution vessel wall imaging. And the interesting thing is that femoxytol is captured by macrophages. So we noticed that there's increased concentration of iron particles within the wall of the aneurysm. Basically, it's an active process of inflammation because active macrophages is an indirect marker of macrophage activation within the aneurysm wall. The processing of this imaging, which is called QSM, quantitative susceptibility mapping, is complex. And we published a couple of series. Oh, I still have 40 seconds. We being able to identify microhemorrhages within the aneurysm and sentinel hemorrhages. Aneurysm morphology, I'm going to talk much because we know about aneurysm morphology, like the presence of blebs or irregularities. And faces, a lot of times there's a lot of data about faces, a lot of clinical scales. Nobody really uses faces, and the reason for that is because faces didn't take into account the presence of smoking or didn't take into account the morphological aspects of the aneurysm. So definitely there is a lot of land for research. One of the limitations, we're still learning about this technology. We see flow artifacts, like in this case of this fusiform aneurysm. You can see with the arrow that there is a flow artifact because probably a stagnation. Partially clotted aneurysms, the same thing. So just to finalize, this is the outline. Can we predict if an aneurysm is going to rupture? No. Contrast enhancement, what does it mean? We are pretty positive, probably means inflammation, but we're still testing the hypothesis. We have to do more experiments. Can we measure it? Yes. What's next? Hopefully a prospective multi-center study. These are our collaborators, and I want to thank the SVIN for the pilot grant and also the B Foundation for the pilot grant to proceed with the study. Thank you.